Hello everyone, today I will be explaining to you the clinical part of the femoral triangle. So the first and most important one is the femoral hernia. So what is a hernia? Hernia is nothing but bulging of the abdominal contents into an opening. So now what type of abdominal contents? Majority of the time it is going to be a loop of intestine. So femoral hernia, in femoral hernia the opening is going to be the femoral canal. So this is the inguinal ligament. This is our femoral artery, femoral vein and the femoral nerve. Okay, this is the femoral sheath and the three compartments I told you about in my previous video. This is the medial side and this is the lateral side. So this medial compartment is our femoral canal. Now it is very easy for the abdominal contents to loop out into this canal and this will cause the hernia. So what is the main cause behind this looping of the abdominal contents? It occurs when there is increase in the intra-abdominal pressure. Now the femoral hernia is more common in females. Why? Because the femoral canal is wider in females than compared to males. So now why is it wider? Because females have a wider pelvis and the size of the vessels is small. Now the femoral hernia is never congenital. And there is one more very important point about the hernia. It is that the bulging becomes prominent on cuffing. Now why is it so? Because when you are cuffing, all your abdominal muscles are going to contract, right? So therefore, there will be increase in intra-abdominal pressure due to which this bulging is prominent. So now what is the course of the hernia? The intestinal loop first moves downwards into the femoral canal. Okay? Then it will move forwards into the saphenous opening. Now saphenous opening is basically modification or opening in the deep fascia and it is enclosed by the cribriform fascia. Okay, so now it will move through the saphenous opening and then it will move upwards along which vessels, superior epigastric and superior circumflex vessels. So this was the course of our femoral hernia. Now what if there is strangulation? So now what is strangulation? So the hernia consists of two parts. This is the neck and this is the sac. So now in case of femoral hernia, our neck will be the femoral ring. This is our femoral ring, right? So this is the neck of the hernia and this will be the sac. So in certain cases, the sac expands, okay, and the intestinal loops are going to be all inside this sac. But the neck is not able to expand and these intestinal loops cannot go back when the pressure in the abdomen is back to normal. Due to this, there will be strangulation and you can see a constant bulge. Okay, so in strangulated hernia, there will be no such thing like you will only be able to see the bulge during cuffing. It will be present throughout. So now how can we treat this strangulation? So we have to treat this by surgery. We have to enlarge the femoral ring. Now because this femoral ring is compact and it is not enlarged, so we have to cut the lacunar ligament. So lacunar ligament forms the medial border of the femoral ring. I have told you in our previous video. So the medial border is formed by the lacunar ligament of the femoral ring. So we have to cut this. Now if we cut the lacunar ligament, obviously the femoral ring will enlarge and due to which the hernia can be removed out easily. Now, what if there is an abnormal obturator artery? So now what is the case of an abnormal obturator artery? Obturator artery is branch of internal iliac artery. So what happens is normally, let us take this is our femoral ring, okay. We have our three compartments, the vein, the artery, and this will be our femoral canal. So now, if this is our inferior epigastric artery, okay, it gives a pubic branch. Then we also have our normal obturator artery, and it gives a pubic branch. So these two branches anastomose with each other. But sometimes what happens is that this anastomosis is too large, and because it is too large, it seems that this obturator artery is branch of this inferior epigastric artery. So now, okay, this is the medial side and this is the lateral side. So now we can see that this abnormal obturator artery is basically passing along the femoral vein. So it is not coming in our way when it comes to cutting the lacunar ligament. But sometimes what happens is that this abnormal obturator artery comes on the medial side. Now it is difficult to cut the lacular ligament. Therefore, the surgeon has to be very careful, else if by any chance he cuts the abnormal obturator artery, there might be severe hemorrhage. Cut leading to severe hemorrhage. Hemorrhage is internal bleeding. Now, another clinical importance is when femoral nerve gets injured. So you will see sensory loss over these two areas, that is front of the thigh and front of leg along with the medial border, which is extending up to the ball of the first toe. Okay. Next we have if there is any damage to the lateral cutaneous nerve of thigh. So how can it get damaged? It may get entangled in the inguinal ligament. Now, in this diagram of the contents, we can see this part. So the lateral cutaneous nerve might get entangled in the inguinal ligament, leading to its compression and damage, due to which sensory loss over the lateral part of the thigh can be seen. Okay. So this is known as meralgia paresthetica. Another clinical point is that positive vascular sign of Nareth. So what happens here is that the femoral artery is not being able to be palpated because of the posterior dislocation of the hip. Okay, so these were all the clinical cases related to the femoral triangle. The most important is the femoral hernia. This was all for today. Thank you.